Next, we will hear from Kate Daniel, the New Mexico Title X Director and Family Planning Program Manager, and Dr. Wanicha Burapa, Medical Director for the New Mexico Title X Family Planning Program. We are grateful to have you both with us today to share your work to expand contraceptive access, especially in rural limited provider settings.
Well, thank you very much for providing us with this opportunity to give our perspective as New Mexico's Title X state office staff who have worked to expand access to family planning services in our own Title X funded clinics, as well as collaborated with other agencies, particularly New Mexico Medicaid, to expand family planning services beyond Title X clinics. It's important to note that the conclusions and opinions provided here are mine and Dr. Burapa's alone and may not be those of the New Mexico Department of Health, the New Mexico Human Services Department, or the Federal Office of Population Affairs Title X. Much of this data comes from our June 2022 American Journal of Public Health article titled Impacts of a Statewide Effort to Expand Contraceptive Access in New Mexico 2014 to 2020. Next, please. New Mexico is the 5th largest state with over 121,000 square miles, but has just over 2.1 million residents, ranking us 36th in population. Approximately 43% of New Mexico's population resides in the center of the state, or the turquoise and mint green section in the center, which is the Albuquerque metro area, Bernalillo, Sandoval, Torrance, and Valencia counties. New Mexico does share borders with Arizona, Utah, Colorado, Oklahoma, Texas, and the country of Mexico. This slide shows 2 New Mexico maps that we included in our needs assessment for the most recent Title X grant application. On the left, you'll see that most New Mexico counties were identified by the Federal Centers for Disease Control and Prevention as areas with high social vulnerability index. On the right, you'll see that Title X service sites or satellite sites with at least one located in almost all of the 33 counties in New Mexico, with the exception of Catron and Harding counties, which have very sparse populations. The majority of New Mexico Title X clinics are New Mexico Department of Health public health offices, indicated by a blue star, which are run by the New Mexico Department of Health Public Health Division in a centralized healthcare system. New Mexico Family Planning Program has been piloting telehealth family planning services across the state, which is for the most part rural and frontier. In the first few months of this year, over 1,000 clients and 61 providers have benefited from telehealth family planning services. Next, please. As the Title X grantee for the state of New Mexico, we have played a critical role in ensuring access to a broad range of family planning and preventive health services, as well as overseeing client-centered care delivery in the state. All of our services funded through Title X are client-centered, and decisions about a client's reproductive health services are made by the client in conjunction with the clinician. In 2021, New Mexico Title X clinical services prevented almost 2,000 unintended pregnancies based on Guttmacher's calculator. Next, please. We impact family planning and reproductive health services in a multi-pronged approach with clinical services and educational programming. Pregnancy and births are significant contributors to the high school dropout rates among girls. In 2018-19's 4-year graduation cohort, 79% of all female 9th graders in New Mexico graduated from high school 4 years later, which is significantly lower than the national rate of 86%. During those same years, the teen birth rate was 25.3 per thousand and 24.4 per thousand, respectively. In the 2018-19 school year, our adjusted cohort graduation rate for all genders was the lowest in the nation at 75%. The New Mexico Grads program, which works with pregnant and parenting teens on 10 unique topic areas, reports that 84% of teen mothers in New Mexico are enrolled in the program in 2022, compared to 53% nationwide. In addition, the repeat pregnancy rate among New Mexico grad students is 2.4% compared to 14% statewide. New Mexico has very progressive health education and comprehensive sex education standards promulgated by the New Mexico Public Education Department. That being said, individual school boards determine what, if any, health or comprehensive sex ed lessons are offered in their school district. Next, please. A broad range of FDA-approved contraceptives are available in 44 public health offices and 2 outreach sites and 15 community or school-based health centers across the state. The use of IUDs and implants increased from 50% in 2016 to 66% in 2021 in all ages, and from 23% in 2016 to 28% in 2021 in teens aged 15 to 19. As you would assume, as the use of most effective methods increased, the reliance on moderately effective methods decreased in all age groups. Next, please.
Now that Kate has provided background about state of New Mexico and our program, I am going to walk us through the journey that Kate and I had traveled through after our implementation of IPP LAG from the Medicaid site in 2013. So if you recall Dr. Cohen's presentation, North Carolina was the first state in 2012, and New Mexico was one of the very first few. I think ours is implemented in April of 2013. So this slide is the poster that was presented in 2016 Title 10 conference, and it summarized the timeline of the outcome of IPP LAG unbundling that Medicaid did in 2013, and our collaborator is at the top. So this is the poster was supported, by the learning community group that Association of the State and Territorial Health Officials, or ASTO, recruited us to join as one of the first state cohorts. And it listed the collaborator here, which are us and New Mexico Medicaid and University of New Mexico staff. Unlike the other states that Dr. Cohen presented in her presentation, University Hospital that located in Bernalillo County represented the majority of IPP LAG claims, which were almost 250 claims in 2014, the year after the unbundling of LAG, of IPP LAG was implemented, went up to 300 approximately in 2015. And interestingly also that the majority of the claims that was filed was from implant. Next, please. So this slide, I would just like to mention that between 2014 to 2018, ASTO supported more of the 4 cohorts, learning community. And the IPP LAG learning community has expanded to include the development of policy and programs to increase access to the full range of reversible contraceptives through this logic model. Next, please. Next slide is the data that I did the query when I served as a New Mexico Medicaid medical director. It's slightly busy graph because it's kind of like helped me put things in perspective before we was exploring to do the publication. The x-axis is the time axis by year between 2010 to 2018, and it was not very obvious of where 2010 started because I, labeled the timeline of the New Mexico Medicaid policy implementation beginning in 2013 by in 20. I'm sorry. In the beginning, like 2012, I believe, is the expansion of the lower age limit for female New Mexico Medicaid beneficiary to be eligible for family planning Medicaid. In the meantime, they also eliminate gender limitation to include men as the family planning Medicaid beneficiaries as well. So April 2013, Medicaid unbundled IPP LAG. In 2014, the third box in the x-axis is when Medicaid adopted Affordable Care Act and expand Medicaid to to higher income beneficiaries. And the last significant landmark of Medicaid policy change is the unbundling of LAC from FQHC's bundle encounter rate. And so in this graph, I have two data presented. The bar graphs represent the number of LAC claims, which I kind of color coded, and the numbers on top is the number of LAC claims total, which went up from 727 in green font on the left-hand side of the first bar graph to over 8,000 in 2018 on this graph. So, and the tip of the bar graph, the orange tip, which you can see in the middle, like the year 2013, that it represents the IPP LAC, number of IPP LAC claims. The teen IPP LAC, the teen LAC claims, not IPP, represented in purple bar graphs in this graph. And as you can see, the widening of the, the purple graph, and in the meantime, the green bar graphs also increasing in height over time. So I superimposed the bar graph of the number of LAC claims, not to imply any association, okay, just kind of exploring the data of number of Medicaid births. It went down from almost 20,000 in the year 2010 to just above 16,000 in 2018. And then I fractionated this line graph into how many of those were teen births, then represented in the red line, like just across the lower part of the bar graph, and how many of these in as in the total for Bernalillo County. Remember I told you the University Hospital is located in Bernalillo County, and I can kind of share that the majority of decline of Medicaid births come from Bernalillo County, and to a minor degree from teen births. Okay, next slide, please. Next slide. So we're gonna go into the publication that we did as in a part of the supplement issue of AJPH. New Mexico captured 2014 to 2020 with 4 major strategies that were implemented in the state. One is provision of low or no cost contraception, which Kate provided overview of mainly provided by statewide Title X clinics. Second is to provide training and technical assistance, and in 2 different formats. One is mainly face-to-face training via LAC mentoring program. This is before COVID, because during COVID, LAC mentoring program also moved into virtual type of training, and LMP provides hand-on skill training as well as billing training. And the second platform is through virtual maintenance type of, every other week type of training with the expert via the ECHO program. Both of the programs launched in December 2016. The third the third strategy is public awareness campaigns, which were run. Kate would know more about this, but it ran in quarter. And every time we ran this public awareness campaign, we'll see the increase in the number of clients in Title X clinics that opted for implants in the following quarter. Last but not least was the various policy change that I highlighted in the previous slide of Medicaid. So next slide. Next slide will show the outcome of this study that was published, and so bear with me. I'm going to walk you guys through this. So this data were from New Mexico Medicaid claims data, and they are presented here in quarterly fashion. So every quarter, the numbers, of the clients who utilize the services and have claims are unique within quarter, but they are not unique across the quarter. So it's just only quarterly unique. And that utilization data were presented in bar graph in this picture. And the black bar represented large claims, and the orange bar represented the moderately effective birth control methods claim, which including by hormonal contraceptives such as pills, patch, ring, injectable, and as well as diaphragm. Okay, so I superimpose in this graph with the number of Medicaid providers who rendering this claim, with the dark bar dark line graph is Medicaid provider who provided services to teens, and the dashed line were Medicaid providers who provided service to young female client, young women from the age of 19 to 24. So as you can see, the bar graphs do not fractionate out the age group. However, I'm going to describe that between 2014 to 2020, the number of LARC users in adolescent went up about 33-fold. And number of adolescent moderately effective users went up about 42-fold. This effect was less observed in younger women between the age of 19 to 24. We only saw 4-fold increase for each LARC and moderately effective user. As far as the number of Medicaid rendering providers to teens as well as to young women, they went up in the same fashion, more in teen provider, 20 folds, and only 4 folds for young women providers. Next slide, please.
The teen birth rate in New Mexico decreased by just over 60% from 2011 to 2021, and by over 36% from 2016 to 2021, while the U.S. teen birth rates decreased by 55.6% and 31.5% in the same years. The second graph shows the other states within our Title X Region 6 and Arizona, which is a state that is very similar to us in many demographic measures. New Mexico started out as one of the highest rates. You'll see the yellow line is New Mexico, and is now the state in our Title X Region 6 with the lowest rate. While the trend is decreasing across all represented states, New Mexico's rate is falling at a faster rate. In 2021, New Mexico was ranked 10th highest in the nation, with a teen birth rate of 19 per 1,000, compared to 13.9 per 1,000 for the U.S. Next, please.
So the next other health statistic that we would like to present that I'm personally very excited is the New Mexico Pregnancy Risk Assessment and Monitoring System survey from the year 2012 to 2019. If you remember in the previous slides that I presented, the data was from 2014 or so, that the interventions, that we capture began. So this graph began in 2012. As you, similar to the graphs that Dr. Cohen kind of presented, the line was kind of flat prior to 2014. And if the line on top, which is blue line, darker blue line, is the line for intended pregnancy reporting by the survey participants. And we saw the increase in the trend, and parallel with the line on the bottom that the women reported unintended or missed time pregnancy that going down. And last, I would like to end this presentation by thanking both ASTO, our collaborators, as well as the Coalition to Expand Contraceptive Access to provide support and technical assistance. Thank you.
Great. Thank you, Kate and Dr. Burapa, for sharing your experience in New Mexico and some of the outcomes that you are seeing in the population.